This is Vermont Edition. I'm Mitch Wertlieb in for Michaela Lafrac. It's no secret to anyone that healthcare spending around the country, and here in Vermont especially, is skyrocketing, even as access to affordable health insurance for many continues to plummet. Lobbying is among the many reasons why healthcare is so expensive, but little is known about the way it works or the impact it has. Lobbying is an industry that operates largely behind the scenes on Capitol Hill and in state houses around the country, influencing legislation that, in regards to healthcare, drives up costs and slows efforts at reform. That's a discovery Alex Garlick made and writes about in his new book, Pre-Existing Conditions: How Lobbying Makes American Healthcare More Expensive. Garlick is an assistant professor in the University of Vermont's Political Science Department, and he joins me now in our Vermont Public Studios to tell us more about what he's learned. Professor Garlick, thank you so much for being here.
It's my pleasure to be here. Thank you, Mitch.
And listeners, you can join this conversation as well. What is your experience with healthcare costs and access to insurance? Do you have experience with the healthcare industry you might want to share? Have you seen any lobbying or other similar practices that could help us understand this complex issue? If so, give us a call, 800-639-2211. That's 1-800-639-2211. Our lines are open. You can also send an email to vermontedition@vermontpublic.org. So, Alex Garlick, you were kind of in the belly of the beast during the first Trump presidential term when his administration was trying to repeal the Affordable Care Act, which made health insurance accessible to millions who didn't have it before. What were you doing at that time on Capitol Hill that gave you a close-up look at who was wheeling and dealing when it came to influencing healthcare law?
Yeah, so I was a congressional staffer for former Representative Joe Kennedy from Massachusetts, and he was on the Energy and Commerce Health Subcommittee. And so that committee was the kind of the eye of the storm for the repeal and replace of the Affordable Care Act. And that was a bill that the first Trump administration thought would be very easy to do. But as that bill was introduced and as the people found out what was in that bill and what it would do to their health care, it became much more controversial before it ultimately failed.
That is so interesting. And that last bit you just talked about, when people found out, I want to get to that in just a little bit, because I think that's relevant to what's happening now that we're hearing about today in the news. But are there, just to give a sort of an overview, kind of that 10,000-foot view of things, are there particular groups of lobbyists that have the most say in these matters, and who do they represent?
Yeah, so in the book, we are mostly looking at the different structure of the healthcare industry. And there's three major groups. You can think about insurance companies, you can think about hospital networks, and then the pharmaceutical industry. There's also professional associations of providers like doctors, nurses, et cetera. But those three major groups, insurers, hospitals, and the pharmaceutical industry, are the ones kind of driving the most costs and that put up the biggest fight in lobbying.
Pretty powerful industries there that you all mentioned, those three.
Yeah, I mean, two of the biggest five companies in the United States, United Healthcare and CVS Health, are these hybrid insurance and pharmaceutical benefit manager companies. They're these massive corporations that touch nearly every part of the healthcare industry, and a lot of the costs that we are paying for in our health insurance go to these massive corporations.
So when I think about the folks that they would hire to do the lobbying for them, I'm thinking that these are going to be some of the best when it comes to lobbying. Is that right?
Yeah, and I think that's right. And I think, if you think about how healthcare is different from other things on the agenda, it's a very complex field. To become a healthcare professional, you need to go through your undergraduate education. You need to get this advanced training. And so it's very difficult for someone that is not a medical provider to understand these issues. And so therefore, when healthcare is on the agenda, legislators and staff like myself find themselves calling these different members of the industry to help them understand these problems. And when the legislators are relying on lobbyists, that gives the lobbyists a lot of power.
Yeah. I'm guessing that most of the lobbying by these groups happens out of sight of the public eye, and I'm wondering if that's by design.
It happens outside of the public eye. By design, yes and no. By nature, healthcare finance is very complex, and complex issues are very difficult for the media and the public to get into. There are healthcare issues that the public can get their head around. For example, Bernie Sanders has had a lot of success talking about healthcare is a human right, therefore we need Medicare for all. That fits on a bumper sticker. A lot of these healthcare finance issues about premium subsidies, the insurance market regulations, that doesn't fit on a bumper sticker. It's hard to get the media interested. It's hard to get the public to wrap their heads around it. And that is a further advantage for lobbyists and the healthcare industry.
It's an advantage, yes, but there's something else going on here too. And, I don't want to paint every healthcare lobbyist as some kind of B-movie villain, twirling a mustache and cackling about doing dastardly things. Yeah. Is there any useful role that lobbyists do play in their interactions with lawmakers who are deciding healthcare policy?
Yeah, they certainly do. And I similarly do not think that all lobbyists are evil or anything. My first day as a congressional staffer, I was actually handling an issue that I didn't have a lot of prior experience with foreign policy. And there was a bill I was supposed to make a recommendation on. I had no idea what to do. And what I did is I called the lobbyists on both sides to help me figure out what was going on. And this is a very common interaction. And the way that lobbyists get invited back into congressional offices is by offering good information and helping legislators and staff understand problems, understand solutions. So I do think that lobbying, by its nature, can be benign. Political scientists, we define it as information transmission. So if they have good information, it can be benign. I think when we get into the troubling aspect of lobbying, it's thinking about how expensive lobbying is and who can afford it. And this is going to introduce bias into the system if only some interests, like the well-money parts of the healthcare industry, have lobbyists, versus when it comes to consumers and patients, they don't have any representation, and there's no one making their case when it comes to these major healthcare decisions.
Well, here's where we get into the nitty-gritty, because it seems to me that healthcare in America is different than just about anywhere else in the world as far as major industrial nations go.
It is, yeah.
It's a commodity here. It's something that is not provided by the government. It is something that, it's dollars and cents. So does that mean that lobbyists and the companies and the industries that they represent, pharmaceuticals and insurance, et cetera, as hospitals that you mentioned, do they have an incentive then to influence lawmakers to keep their costs down, perhaps at the detriment of healthcare that people need?
Yes.
Yeah, I had a feeling that was going to be the answer.
I mean, it's a short answer and a long answer. I think lobbyists are not all powerful. They can't snap their fingers and have legislators do their bidding. What they can do, though, is when they get organized, when they use their information and their considerable resources, they can certainly push back. And one of the things that the book shows is that lobbyists are much better at keeping things from happening than making things happen. So in the case of cost containment, like you just mentioned, lobbyists are very effective at when there's bolder ideas to rein in costs and to bring things down and the revenue of the healthcare industry is at stake, that is when they're most effective, and they are able to diminish this legislation that's trying to rein in costs or outright defeat it.
We're speaking with Alex Garlick. His new book is called Pre-Existing Conditions: How Lobbying Makes American Healthcare More Expensive. Give us a call if you'd like to join this conversation, 800-639-2211, or send an email to vermontedition@vermontpublic.org. Let's take a call right now. Mish is on the line from Plainfield. Hi, Mish.
Hello. Good to hear you.
Yes, and you as well.
Speaking.
Go ahead.
Yeah, speaking with 50 years as a systems analyst, looking at feedback mechanisms. And the background is that my wife and I moved from Montreal to Vermont, Plainfield, in 1998. My wife was a physician, a neurologist. When she moved to the United States, she realized that instead of having a single payer, the Régie de l'Assurance Médicale du Québec, she had 15 different companies, most of whom had employees with no medical training who tried their best to contradict the doctor's best formed opinion on appropriate treatment of patients. This is a flawed feedback system. The more the insurers interfere with medical care, the greater their profits. The other issue, and I'll be quiet after this, is that it is legal in the United States for organizations that hire lobbyists to bribe politicians. They don't call them bribes, but they pay politicians benefits for following their instructions. And now I will be quiet and listen to the rest of the program.
Well, Mish, I very much appreciate your perspective on this, especially coming from Canada. It's something we're going to get into here. But Alex Garlick, I would love for you to take up some of those things that Mish just talked about, especially the part about a bribe that's not really a bribe. It's not called that, but is he onto something here?
Yeah, so the campaign finance aspect of lobbying, there's an above board and a below board. aspect here. And, reporters, investigative reporters have documented times when there's illicit contributions. I think equally concerning is what happens legally that then leads to outcomes that I think are more in the private interest than the public interest. So if we look at the 2010 Affordable Care Act, I have a colleague who documented specific asks that were made by New Jersey-based medical device manufacturers to former Senator Bob Menendez, a Democrat from New Jersey. And he put their request directly into law in the ACA. And so it is documented that these campaign finance donations can lead to private benefits. On the whole, that's, I don't think, the largest concern when it comes to lobbying. Mostly what we find with campaign finance is it gains lobbyists access and it gets them in the door. What they do behind closed doors is, a subject of study, but that's what we're sure of is that campaign finance gets lobbyists in the doors when, if private citizens, if they go and try to talk to a member of Congress, it's a lot harder for them to get time.
What about this notion that Mish was talking about where sometimes there will be a direct contradiction between what a doctor is recommending and, what a lobbyist maybe will be reporting or that sort of thing?
Yeah, this is an increasingly important issue in the United States. And the key word here is prior authorizations. And the idea with prior authorizations is that you may, as a patient, think that your insurance will cover what you need. But increasingly, insurance companies are making doctors receive prior authorizations of that, and they are using that step to deny care in advance.
But that's not the same as a pre-existing condition clause? What's the difference there?
A pre-existing condition clause is this was enshrined into law in the Affordable Care Act, which is that if you have pre-existing conditions, you should have access to health insurance. But I think one of the issues that we've seen in the years since the ACA has been signed is even people that have health insurance in the United States, whether it's private or one of the public systems, are having trouble affording the bills that come along with health insurance. People have these high deductible plans that are several $1,000s a year, or they find themselves running out of money to pay for things that they assumed that their insurance would cover. And the problem with prior authorizations is that it is perhaps limiting what a patient is eligible for. And then there's this other burdensome process for the medical doctors and the hospitals and the physicians' offices. They're now having to do this entirely burdensome step of paperwork, which is slowing them down and probably adding to the backside and making it not as enjoyable a job to have. And that can come back and bite us on the other side.
See, it's the simplicity versus the complexity that I think drives a lot of us crazy when we start talking about this. And you had mentioned investigative reporters who look into this. The topic is so complex and it's mired. It's so hard to comprehend the fiscal issues as well that are involved here. So does that make it difficult for the media to cover and report on these issues, or has the effort just not been made to make the process more visible to the general public?
I think healthcare finance is one of the most difficult things for the media to report on and for consumers and citizens to understand. Just if you buy a product at the local farmer's market, there's a buyer and a seller. They have a carrot, you want a carrot, whatever. When you get your health care, you are getting it from a physician's office, and then there's a third party involved, the insurance company, and then many other steps. Let's say you need a prescription. Your prescription, you get it at your local pharmacy, but it's covered by your pharmacy benefit manager, who actually might be owned by the same company that owns the insurance company, and perhaps they also own your physician practice. It's very difficult to understand, and all of these interchanging interactions, it make it difficult for the media to get in there and explain what exactly is going on.
Do you blame the media? Should they be trying harder? I mean, we're kind of focusing on ourselves here a little bit. But it is complex, though.
I don't think the media is the biggest problem here. I think the bigger issue is how legislators and policymakers in the executive branch, how hard they're willing to fight. How hard are they willing to do the work it takes to not only understand these issues themselves, but then communicate to the public what they're doing and why.
Yeah, that's key. I promise we're going to get into that. I have so many questions about that as we move on. But we got this question here from Dave in Jamaica who writes, perhaps this is far afield, but is there a chance that lawmakers will or lobbyists will be using AI to write legislation? Artificial intelligence is already being used by insurers to determine the approval of care, at least according to Dave in Jamaica. Is that right?
There's a threat. I'm a college professor, so I'm well aware of everyone around me using AI in nefarious ways. And so I think it's something we all have to be extremely vigilant about. I think that this is probably not a top of mind issue right now when you think about legislation getting passed at the state or the national level. The amount of steps that something needs to go through. What I'm more concerned about than computers being at the origin of legislation is what happens in the steps that no one can see. And a major thing that happens in the United States Congress, at least, is the final bill that usually gets voted on. It comes out of a committee in the middle of the night, and no one really knows what it is. People always blame legislators like, oh, they didn't read the bill. If you've ever sat down and read a bill, it's impossible to understand. It's thousands of page longs. It's all references to other parts of the United States Code. No one can read these bills. And
it's like the Apple iTunes terms of, that you have to, nobody reads that stuff.
No one reads that stuff. And even if you try, you can't. And that presents an opportunity for lobbyists that do know what their specific clause is to get in there and make a big impact.
This is such a meaty topic. We're going to get into a lot more of it. If you want to ask Alex Garlick some questions about lobbying and healthcare, give us a call at 800-639-2211. You can also send an email to Vermont Edition at vermontpublic.org. More with Alex Garlick in just a moment. This is Vermont Edition. Welcome back to Vermont Edition. I'm Mitch Wertlieb in for Michaela Lafrac, and today we are speaking with Alex Garlick, the author of the new book, Pre-Existing Conditions: How Lobbying Makes American Healthcare More Expensive. And if you want to join this conversation, if you have some questions about the insurance industry, about healthcare costs, about lobbying, give us a call at 1-800-639-2211. That's 1-800-639-2211. Or you can go to Vermont Edition at vermontpublic.org to send us an email. So, Alex Garlick, we were talking before the break about the complexities of these issues, how lawmakers are sometimes blamed, rightly or wrongly, for what comes out of Washington and how complex that process itself can be. But one thing that is always just perplexed me is why the legislators who do greenlight these laws governing healthcare don't seem to pay a political price for doing so. If healthcare costs keep rising for the average American, and they are, and access to health insurance keeps drying up, why don't there seem to be consequences at the ballot box? Is there a false narrative being spun that keeps the drivers of these costs protected?
That's a great question. I think one of the issues when it comes to healthcare compared to other issues that have had an impact on the election. In the 2024, this was supposed to be the election about inflation. Everyone was worried about grocery prices. But when you go to a grocery store, you see eggs cost $9. You think to yourself, wait, a year or two ago, these eggs cost $2.50. What is going on here? When it comes to healthcare, what does anything cost? You go to see your hospital, or you go see your doctor, you go to the hospital, you get a letter a month later, your explanation of benefits. This thing costs tens of thousands of dollars, and your commitment was $250, and actually you owe us another $40 later. It's very hard to know what things cost. And so from an individual perspective, it's not so easy to grasp on what exactly has changed. And then the other issue is that many of the costs in healthcare are socialized, where they're spread around many people. And I think for many years that has allowed for some of these practices to take off without generating a lot of public feedback. But personally, I've lived in Vermont for 3 or 4 years, and every year I'm getting this note that my insurance is going up 10, 15, 20%. That's getting hard to ignore.
We often hear politicians who don't want health care reform say that while Americans do pay more, they also receive the best possible health care of any nation in the world. Do the facts support that?
I think the best medical institutions in the world are located in the United States. I think that's true. I think the best care that can be provided is provided in the United States. I think the issue, though, is not so much the ceiling on care. It's who has access in the middle and who has access at the bottom. And I think when we're often talking about health insurance access, people think about insurance. But one of the points I'm trying to make in the book is as insurance gets more and more expensive, many people are choosing to opt out of it, even if it's subsidized, even if there's all these government machinations to make it more accessible. They're still choosing to opt out. And even if you have insurance, that doesn't mean you won't eventually go into medical debt or you won't be able to afford some aspect of your care. So I think these problems are getting more insurmountable for people.
Let's go to the phone lines. Pete is on the line with us from St. Johnsbury. Hi, Pete.
Hello. I'm a 50-year alumnus of the healthcare field. having worked in hospitals and clinical laboratories for all that time in management roles. And I have come to the conclusion that the only way to fix this system is 100% federal takeover of the system, including reimbursement, the ownership operations of the hospitals, the physicians' offices. There's no way that this can continue. People are not getting health care who should have it because they can't afford it. And it just is getting more and more expensive all the time. And insurance companies and lobbyists and pharmaceutical companies have to just deal with it.
Pete, I really appreciate that question. Something that I've been thinking about myself too, and we're going to get into it in just a little bit. But Alex Garlick, what is the feasibility of that kind of federal takeover of healthcare that Pete's talking about here?
So one of the things I saw when I was working in Congress in 2017, this was right after Bernie Sanders' very successful 2016 run, where he got a lot of attention and a lot of energy behind his call for Medicare for All. When that bill actually landed in Congress and people looked at what that would do, it's a politically difficult issue. And I actually think the Bernie and his followers make a pretty good argument that a true single-payer system could save money. The way it saves money is by eliminating a lot of so-called middlemen, insurance companies, pharmacy benefit managers along the way.
And that paperwork and stuff you were talking about before.
Exactly. But, those are two of the 5 biggest companies in America. Another 2 are in the top 10. The healthcare industry is massive. Tens of thousands, hundreds of thousands of people are employed by this industry. And so that's not so much a lobbying issue of what's happening behind closed doors. That's a political issue of, do you have policymakers and leaders that are willing to, potentially take on one of the largest industries in this country? People will lose their jobs in order to make care more efficient. I think, this is an issue worth exploring because there's a moral case that Pete, our caller, just mentioned, which is that healthcare is different than other things people buy. This is not a car. And I think that can gain purchase with the public. However, that is a very high hill to climb.
Well, that's an argument that Bernie Sanders, as you mentioned, has been making for years, for decades. He's saying healthcare is a human right, and it shouldn't be treated the way we, treat the car industry or, buying stoves or what have you. But that it seems like sometimes that argument knocks on the door, but nobody's really opening the door yet to that.
No, and I'm a political scientist, so we're obsessed with counting the beans of what happens at elections. And for all the energy that Bernie generated, neither time could he get really a majority of Democratic primary voters behind that. So I think there's still, I don't know what has to happen with healthcare as a field to convince a larger swath of people to get behind this. But as of now, the coalition would need to expand of people trying to make this argument. Even though there's a moral argument, it does need to expand to try to bring more people in to think about healthcare being a human right and something that should be publicly provided as opposed to privately provided.
What about the potential for smaller wins? I mean, the larger problem still looms. But again, getting back to Bernie Sanders, he's drawn a lot of attention to things like the price of generic pharmaceuticals here in the U.S. compared to the same drugs in Canada, which are far less expensive. And so when at least it comes to drug prices, there's been this, I think, at least a showing of bipartisan support. I've heard of some Republicans who are open to this idea about letting the government negotiate with companies to bring down prices. Has there been any actual action on that front, or is it all just talk?
Yeah, so I don't want to be in the business of trying to tell the major parties how to win elections, but I think
go for it, please.
I think it is clear that pharmaceutical prices are something that both parties have grabbed onto as an issue. The most significant thing the Biden administration did in terms of healthcare finance in 2022 with the Inflation Reduction Act, they allowed Medicare to negotiate the price of drugs. This is kind of mind-blowing for people that this massive government agency was never negotiating the price it would pay for something, but it was that had been Congress had previously prevented Medicare from doing that. So now Medicare has that right. This is the most powerful tool the federal government has. And I think we're seeing a little bit of mismatch of rhetoric and policy action on the right regarding this. Donald Trump, more so than nearly any other Republican, has gone out there and attacked the pharmaceutical companies. He thinks they charge too much. He thinks that it's unfair that they charge less for the same prices in foreign countries than they do to Americans. But then what is the policy action to come back on the other side of this. He's had a couple tweets or whatever we call them now, attacking them. I guess they're standing up a website now. He's not really using that key tool, the Medicare price negotiation tool. And
Yeah, okay. That you pretty much answered my question on that one. That's where I thought it was going. Let's focus on Vermont specifically for a moment here. We're a small state, yet we consistently rank among the highest in terms of spending per person on healthcare and for insurance rates. A lot of small rural hospitals are in danger of closing or having to drastically cut back their services, and the state's largest health insurer, Blue Cross Blue Shield, has warned its reimbursement rates are so low they could, in a worst-case scenario, have to stop operating the state entirely. Is lobbying in Montpelier among the major drivers of our scary healthcare cost numbers?
Vermont's, despite being at the University of Vermont, it's not an easy case to explain. Vermont has taken a number of the steps that someone like me would recommend a state take to address their healthcare costs. They've stood up this regulator that has the power to reject, hospitals' rates on an ongoing basis.
That's the Green Mountain Care Board.
The Green Mountain Care Board, and also has oversight of the insurers. And so there is a regulator that is in the mix here, and that can make an impact. The problem I think that the Care Board has run into is that, at least on the side of the state that we are here, the University of Vermont Health Network essentially has a monopoly. As you mentioned, we really only have one health insurance company that operates statewide. And at least on this side of the state, we really only have one hospital network. So even though the Care Board has the ability to control prices to a certain degree, when there's only one provider of services, that puts them in a very difficult position. Because when they try to lower the rates that UVM was paid, UVM Health Network, I should be clear, was paid last year. The health network said it was going to stop providing services like dialysis, like behavioral health care. And both sides kind of came back to the table, and I think they reached a reasonable compromise. But the regulator has to be careful because when there's only one provider, they don't want to step on too many toes.
Is there a possibility that big healthcare provider I mentioned and that you mentioned could in fact say, we just can't operate here anymore? And what would happen if that was the case?
There's not a lot of great options. A couple years ago, United Healthcare, that represents, it's more of a national company, but they have subscribers in Vermont. They could not reach an agreement with UVM Health Network and was out of network, and those subscribers were left out in the cold. So I see this as kind of like an existential issue that the state executive branch, the legislature, needs to keep in mind, which is making sure that these different bodies that exist, the insurers, the hospital network, the Green Mountain Care Board, all play nicely because there's not a lot of alternatives.
This is where I want to get now into some of the things we mentioned, touching on things like, federal healthcare takeover, that kind of thing. I recall speaking with two former Vermont governors who had big visions for healthcare reform. One was Peter Shumlin, who lobbied hard for Vermont to adopt a state universal healthcare system in 2013. Ultimately, that was abandoned when the effort proved to be too expensive. He just didn't see a way to pay for it realistically. On a larger scale, Howard Dean was a proponent of creating a public option system. Now, it wouldn't do away with private insurance, but it would allow people to choose if they wanted to get on a government insurance plan that could compete with the private market. Could that concept, in your view, have any chance of gaining traction in today's political landscape? The public option I'm talking about here. Yeah,
the public option I do think has a chance. And it was really the most ambitious cost containment idea that was on the table for the Affordable Care Act in 2010. Of course, it was stripped out by Joe Lieberman, the senator from Connecticut that represents Aetna and Cigna and some of these major health insurance companies. So that's a kind of a classic lobbying story.
But I remember it well. Go ahead.
Yeah, in more contemporary times, there are two states that have tried this in recent years, Colorado and Washington. And Colorado's another kind of classic tale of lobbying influence where the farther they got down the road, the harder the insurance companies were making for it. So the quote-unquote Colorado option that exists ended up just being the insurance companies essentially promising to offer a lower cost plan. Washington, they stood up a more robust version, but the costs are proving hard to bring down. And specifically, the argument that legislators just, no matter how Democrat, how progressive they are, they have trouble getting over is it's really going to be difficult for rural hospitals to exist if the reimbursement rates come down. And You can then imagine my surprise when this past summer at the federal level, we're talking about pretty massive cuts to Medicaid. And all of a sudden, the rural hospitals are again raising their hands saying, this is going to be difficult for us. But it kind of shows how difficult this problem is to unwind.
Is that, you don't want things to get so bad that you have to hit rock bottom before they get better. But I'm just wondering if that's what it's going to take here, because getting back to the public perception of all this and why politicians who consistently vote to keep the status quo don't seem to pay a price. Yeah. Wouldn't ultimately, especially in some of these red states where there are small rural hospitals that would absolutely have to shut down, isn't there going to come a time when people start to pay attention and say, this isn't working, I'm getting hurt here, and the people that I'm voting for are hurting me?
I don't know if it's necessary, but I fear that's the direction we're heading, where this current government shutdown, it's what's at stake in this government shutdown is, will these ACA insurance markets that tens of millions of people now rely on, will they be subsidized by the government? Because if they're not subsidized by the government, they're going to be unaffordable for people. And we're going to start seeing gaps emerge. And the ACA that was passed in 2010, it had two goals. They wanted to lower the cost of care and increase access. I'm pretty skeptical on what it did to lower the cost of care, but it's undeniable that more people have access to health insurance. But that doesn't mean we can't go backwards. And I think, giving people access to health insurance is a great goal. It's all well and good. But if the hospitals are closing, if their local doctor's offices no longer exist, health insurance on its own doesn't give you anything. So I think I'm worried that, as these changes continue to evolve, we're going to head down this way, which, by the way, doesn't really make care more affordable for people if our hospitals are closing, because what that does is it sends more patients to these major medical centers, to their ERs, and that is expensive care for them to provide.
I want to read this email that we got from Paul. It says, the only way we can change our system is by passing campaign finance reform measures and or imposing term limits on members of Congress. The parties making so much money will never give up control. Very briefly here on this issue that we mentioned, we're talking now during a government shutdown. Democrats are sticking to a health care issue on this one. Mm-hmm. Do you think they're picking the right political fight here? And you're a political scientist, so I can ask you that.
I know. I talk about Congress every day. I think it's very difficult to win quote unquote win. I don't think anyone ever wins a government shutdown, but usually one party loses it. It's very difficult to be the party that initiates it. And so the Democrats are initiating this one. So despite the fact that parties really win these arguments, I think having something to talk about, and they want to talk about these ACA subsidies, and they want to talk about people having health insurance, it does make sense to me to have a single issue to talk about. And Democrats don't control a single branch of government right now, so they're unlikely to have huge policy gains. But to your prior questions, I think they need to start talking to voters about what changes are happening and how that affects them personally. And if this is their hill to die on, it makes sense to me.
All right, one last question here from Julie in Jericho. This might be a stupid question, she says, but who's lobbying for the patients? And Julie, that is not a stupid question.
I don't think it's a stupid question at all. Your first question was about the 2017 Repeal and Replace bill. And that bill failed because the American people realized that 30 million people were going to lose health insurance, and they called their members of Congress. And the lobbyists that were on the ground in D.C., and I was on the ground in D.C. for this, they channeled that energy. They were able to use that to organize members of Congress against it. So even though the book has a black cover and a shadowy figure, it's not all bad stories. Some things can happen. And, lobbying is actually a First Amendment protected right of the American people. You have the right to petition your government. And that has been used in the past to win policies that benefit the American people, and it can be used again.
Alex Garlick is the author of Pre-Existing Conditions, How Lobbying Makes American Healthcare More Expensive. A fascinating discussion, a really important read, and I want to thank you so much for taking the time to come in and speak with us about this today. Thank you.
It was a real pleasure, Mitch. I wish I had better news for you.
Well, maybe we'll have you back in the future, and there will be better news to talk about. We're going to come back in just a moment. We're going to be speaking with former Chief Justice of the Supreme Court here in Vermont, Jeffrey Amestoy. He's written a fascinating new book about a sensational murder trial that happened in Vermont in the 1920s. We'll be back in a moment. This is Vermont Edition. Welcome back to Vermont Edition. I'm Mitch Wertlieb in for Michaela Lefrak. If you're a history buff and I mention the name Clarence Darrow, you'd understandably think of the so-called Scopes monkey trial in 1920s Tennessee. Darrow was the real-life attorney immortalized in the 1960 film Inherit the Wind, that delved into the trial in which he argued that evolution should be allowed to be taught in public schools. But Darrow also argued a sensational murder trial right here in Vermont, in Windsor, in 1926. It's not a widely known case, but it has a fascinating backstory that's been brought to light in a new book called Winter's Time, A Secret Pledge, A Severed Head, and the Murder That Brought America's Most Famous Lawyer to Vermont. It's written by Jeffrey Amestoy, and if that name sounds familiar, it's because Amestoy was Vermont's Attorney General from 1985 to 1997. He then became the Chief Justice of the Vermont Supreme Court, serving until 2004, and he authored the groundbreaking Baker decision in 1999 that said Vermont's prohibition on same-sex marriage denied rights granted in the state constitution. That was a decision that ultimately paved the way for successful civil unions legislation in Vermont. Jeffrey Amestoy is now here with me in the studio. Thank you so much for joining us today.
Thank you, Mitch. Great to be here.
Great title for the book. I want to say it one more time. Winter's Time, A Secret Pledge, A Severed Head, and the Murder That Brought America's Most Famous Lawyer to Vermont. I mean, what a case here. It feels like you could have done one of those trendy true crime murder podcasts about this case. It features a famous, nationally known attorney from the 20s. It's steeped in drama, yet there isn't much known about this. When and how did it first come to your attention?
Well, it first came to my attention as a very young lawyer a very long time ago, actually in Windsor, Vermont. And I was in the Woodstock Superior Court getting ready for my first appearance in court, very nervous, surrounded by senior lawyers in the lawyer's room. And in order to make conversation, I pointed to a picture on the wall, and I said, "What's that all about?" And it happened to be a picture of participants in the Winters trial. The defendant was named John Winters. And one of them said, "Well, it's the most famous murder trial in Vermont's history." And I remember thinking at the time, well, that might make a good story. But it was really 2 or 3 years later when I was an assistant attorney general researching a case. I came across State versus Winters, which had been argued to the Vermont Supreme Court. And when I looked at who was representing Winters in that appeal, it read Clarence Darrow of Chicago, Illinois. And to at least certainly someone from my generation, it just didn't make any sense that Clarence Darrow would be in Vermont representing this defendant. He was not just the most famous lawyer in the United States, he was an enormous celebrity. So that got me interested in writing a book, but took me. I made a detour before I got back to it.
Yeah, as we mentioned, an important detour. So tell us about the crime at the center of this story. What happened to Cecilia Gullivan, and why did what happened to her bring Clarence Darrow to Vermont?
So Cecilia Gullivan was murdered in Windsor, Vermont on the night of November 6, 1926. She was a very prominent, probably the most prominent businesswoman in Vermont. She was an executive treasurer and really ran for a large period of time the Cone automotive plant in Windsor, Vermont. And I knew a little bit about Windsor's history, having practiced law there. But even to me, it was a surprise to learn the extent to which Windsor and Springfield, Vermont were part of what was then known as Precision Valley. And the machine tool industry was really revolutionizing not just the United States, really the world. They had developed products that could replicate machine parts, and that just made an enormous difference in terms of the Industrial Revolution. And so Windsor was really the center of that. It's very much analogous to the Silicon Valley in the turn of this century. And consistent with that, it was unusual, just as it was in the early days of Silicon Valley, to have a woman at that level of authority in Precision Valley. So her murder was a front page news, not just in Vermont, but really in Boston and really all over the United States.
And I'm guessing from the title of your book, it was a pretty grisly murder.
It was. It was a brutal murder. She was found. She lived in a lot of ways. She was the epitome in the 1920s of the so-called modern woman. She was single. She was in her 40s when she was married. She had her own house built. She drove her own car. And she was a well-known figure, wore the fashions of the 1920s. And it just was a circumstance under which I thought, particularly the more I got into looking at the circumstances of the culture of the time, that really sort of reflected the 1920s, roaring 20s in rural Vermont.
So when she was murdered, Clarence Darrow eventually ends up coming. She was the man convicted or accused of the murder was named John Winters. And so the reason Clarence Darrow comes to Vermont is because going back even further, I think to 1904, right? Clarence Darrow had some affiliation with Winters' family, and that's what eventually brought him to argue this case?
Yeah, it was even a little more dramatic than that. Clarence Darrow had one son, Paul Darrow, with whom he was very close. And Paul was a student at Dartmouth College. In fact, he was 3 days from his graduation. He was out on horseback. The horse reared up, spooked by a steam engine, either from the train or from the horseless carriages that were just beginning to show up in Vermont. And it trampled a 5-year-old boy. And Darrow was not at fault. Paul Darrow was not at fault in the accident, but he was so devastated by it. He promised the mother of the child that if anything ever happened in her family where she needed help, that his father, Clarence Darrow, even in 1904, a famous lawyer, would come help. 23 years later, Darrow had just announced his retirement. It was big news. It was in the New York Times. He made his first appearance after his retirement at Dartmouth College, where his son had been, to speak about his opposition to capital punishment. He was always opposed to capital punishment. Really drove a lot of what he did. Students, after his talk, said, "A woman wants to see you." And a woman came up, had this letter from his son, Paul, who said, "Your son has promised help to me." Clarence Darrow knew nothing about this at all, but he said, "Yes, what help you need?" And she said, "Well, my nephew is on death row in Vermont." And Darrow immediately wrote his son and said, "Of course, I'll do what I can to help. I'm sorry you have lived with this all these years." So that was the backstory that brought Darrow to Vermont.
Amazing. So he comes to argue this case. I don't want to give away too much, and yet it's sort of a central part to the story here. So was Winters guilty of this crime?
So that's something the readers will have to make up.
Okay, I don't want you to give it away because that is kind of the fascinating kernel.
Just a little context in terms of that. First of all, as I said, I think the book is, I hope, published by the Vermont Historical Society, and I think one of the reasons they were interested in it, because it gives a glimpse of, as I said, the culture of Vermont in the 1920s, which wasn't all that different from the rest of the country. Coolidge was president. It was Prohibition, and we were at a point in time where due process was not the same process that's due now. Winters was an ex-convict. He'd served 6 years in prison in Windsor prison, which is in Windsor. The state prison for Vermont is in Windsor. He was living in Windsor. The police picked him up as someone who could be a suspect. At that point in time, they could put him in a death cell, which they did, and really spent 5 days really trying to get a confession from him, which he was unwilling to give. When he got out, the court assigned him a lawyer, and then from then on, there was the trial. The trial was an extraordinary event in itself because of that's where the severed head piece comes in. That something that has never occurred in Vermont, which I well knew, and not, I don't think, in any place else, at least in modern times, in the United States, the introduction of the severed head of the victim as a exhibit before the jury. So that made it a case that was extraordinary in its own right before Clarence Darrow ever got involved.
Yeah, that's what I was going to say. It's a sensational trial even without Darrow coming in. But here comes Clarence Darrow, perhaps, as you said, one of the most famous people in America at the time. What was the effect of that on the jury, if there was any? I mean, does a celebrity like that coming into a case like this, in your experience, as a judge, can it affect the jury even if they wouldn't say so themselves?
Well, the point to remember is Darrow didn't enter the case until after there was a conviction. So Winters
and he's trying to prevent the death penalty.
That's
happening.
right. Winters is convicted. He's sentenced to death. So Vermont had just moved to an electric chair. There had been one Vermonter electrocuted. Winters would be the second, but Darrow did not participate in the trial. The governor appointed a special prosecutor, a man named Raymond Traynor, who was reputed to be Vermont's best trial lawyer, and he was a great trial lawyer. But the case against Winters was entirely circumstantial. But of course, the effect of demonstrating as an exhibit the severed head of the victim can only be imagined, and I think it's very difficult to see how a jury could ever have maintained the presumption of innocence once that head was introduced into evidence. The extraordinary piece of it was the defense did not object to the introduction of that as a piece of evidence. At that period in time, if you didn't object and save your objection as a issue to take to the Vermont Supreme Court, then you couldn't argue it. So when Clarence Darrow got in the case, of course, he I'm sure said to the Vermont lawyers, "Why didn't you object to this?" Well, for whatever reason, they did not. So Darrow could not argue in his appeal to the Vermont Supreme Court about the prejudicial effect of the severed head, but he did have another issue to argue.
Did he give an impassioned defense of Winters in not getting the death penalty? In other words, was he a champion of saying, "Look, this is not right. You can't kill this man"?
Well, he certainly felt that way, but that wouldn't be an argument that wouldn't be proper in front of the Vermont Supreme Court, where you're expected to argue the law, not the emotion of the case. And the issue in the case on appeal, there were 7 issues that were briefed, but only one turned out to be important. It was the question of whether the trousers that Winters allegedly had on the night of the murder were in fact had blood on them. The question was whether the victim's blood. The state could not show that. The test did not show it was the victim's blood.
Was that something they could determine at the time?
They could, but they just, for whatever reason, weren't able to do it. Huh. So the defense offered to introduce evidence that the blood came from the fact that he had cut his finger shortly before that. And the judge would not allow that evidence to be introduced. And that became the central issue on the appeal to the Supreme Court, whether the defense was allowed to introduce evidence that would have showed that there was blood on the trousers consistent with innocence, that it was from a cut finger rather than from a potential murder.
It's amazing the details you dug up about this case. Briefly, Jeffrey Amestoy, while you were researching the book, you crossed paths with a relative of the victim at the center of the case, Cecilia Gullivan. Did you get to talk at all?
Yes, we certainly did. And in fact, we spent some time together in Windsor. She was a distant relative, but had, much to my amazement, had started her own research on the case at exactly the same time. Wow. So she was very helpful. And in fact, I think one of the most striking pictures in the book is a picture of Cecilia Gullivan, which she had and graciously let us use.
What a fascinating case. And very briefly, any plans to go into murder podcasting or true murder crime stuff?
Well, actually, I just did do a murder podcast.
Did you really?
One called Most Notorious. So I have to admit, I was unfamiliar with murder podcasts, but there's more than one out there apparently. So it's interesting to do. And again, it reflected this culture today is as much interested in murder as the 1920s were. And so I think there are several themes in the book that will resonate with Vermonters, and that's one of them, I think. Yeah,
absolutely. It's a terrific read. That's Jeffrey Amestoy, and he is the author of the new book called Winter's Time, A Secret Pledge, A Severed Head, and the Murder That Brought America's Most Famous Lawyer to Vermont. Thank you so much for taking the time.
Thank you, Mitch.
And that's going to have to do it for today. You can weigh in on our show as always. Pitch us ideas by emailing Vermont Edition at vermontpublic.org, and you can find us on Instagram. Today's show was directed by Leah Papes. John Ahrens is our managing producer. Andrea Lorian and Daniela Fierro are our producers. And today's call screener was Rick Barrett. Our theme music is by Myra Flynn. I'm Mitch Wertlieb in for Michaela Lefrak. Thank you so much for listening, and I hope we'll catch up again soon.